Rabies. Rabies is a vaccine-preventable, zoonotic, viral disease. Once clinical symptoms appear, rabies is virtually 100% fatal. In up to 99% of cases, domestic dogs are responsible for rabies virus transmission to humans. Yet, rabies can affect both domestic and wild animals. It is spread to people and animals through bites or scratches, usually via saliva. Rabies is a virus that attacks the central nervous system. It's found only in mammals. Rabies is present on all continents, except Antarctica, with over 95% of human deaths occurring in the Asia and Africa regions. Rabies is one of the neglected tropical diseases, NTD, that predominantly affects poor and vulnerable populations who live in remote rural locations. Approximately 80% of human cases occur in rural areas. Although effective human vaccines and immunoglobulins exist for rabies, they are not readily available or accessible to those in need. Globally, rabies deaths are rarely reported and children between the ages of 5 to 14 years are frequent victims. Managing a rabies exposure, where the average cost of rabies post-exposure prophylaxis, PEP, is currently estimated at an average of $108. It can be a catastrophic financial burden on affected families whose average daily income may be as low as $1.2 per person. Every year, more than 29 million people worldwide receive a post-bite vaccination. This is estimated to prevent hundreds of thousands of rabies deaths annually. Globally, the economic burden of dog-mediated rabies is estimated at $8.6 billion per year. Rabies is an illness you get from an infection with the Rab virus. The most common way to get rabies is through bat bites, in the US, or dog bites, in Asia and Africa. How is it spread? Normally, rabies is spread through a deep bite or scratch from an infected animal. In the United States, rabies is mostly found in wild animals like coyotes, raccoons, skunks, bats, and foxes. Most humans infected with the virus got it from bat exposure. The best way to avoid getting rabies is to have your pets vaccinated. What are the symptoms? Typically, there are no symptoms right away. Rabies can lay dormant in your body for 1 to 3 months. Doctors call this the incubation period. Symptoms will appear once the virus travels through your central nervous system and hits your brain. The first sign that something is wrong is fever. You might feel generally tired or weak. You may also feel pain, tingling, or burning at the site of the wound. As the virus spreads through your central nervous system, you'll develop other, more severe symptoms. They include insomnia, inability to sleep, insomnia, anxiety, confusion, slight or partial paralysis, hyperactivity, being easily agitated, hallucinations, salivating more than usual, difficulty swallowing. In time, these symptoms give way to coma, heart or lung failure, and death. What are the symptoms of rabies in humans? You usually have no symptoms of rabies for several weeks after it enters your body. When rabies makes it to your central nervous system, prodromal phase, you experience flu-like symptoms. In the final stages, you have neurological, brain, symptoms. Prodromal symptoms of rabies: fever, tiredness, fatigue, bite wound burning, itching, tingling, pain or numbness, cough, sore throat, muscle pain, nausea and vomiting, diarrhea. Acute neurologic symptoms of rabies. Neurological symptoms of rabies are either furious or paralytic. Furious rabies symptoms may come and go with periods of calm in between, furious episodes. Furious rabies symptoms: agitation and aggression, restlessness, seizures, hallucinations, muscle twitching, fasciculations, fever, racing heart, tachycardia, fast breathing, hyperventilation, excessive salivation, 2 different sized pupils, and isochoria. Facial paralysis, facial palsy, fear of water/drinking, hydrophobia. Fear of air being blown in your face or drafts, aerophobia. Paralytic rabies symptoms: fever, headache, neck stiffness. weakness, especially starting from the body part that was bitten and progressing to other body parts. Tingling, pins and needles or other strange sensations, paralysis, coma. Rabies virus, RABV, is transmitted through direct contact. It is such as through broken skin or mucous membranes in your eyes, nose, or mouth. It could be with saliva or brain or nervous system tissue from an infected animal. Rabies is fatal but preventable. It can spread to people and pets if they are bitten or scratched by a rabid animal. What happens when you get rabies? Rabies virus gets into your body when the saliva, spit, of an infected animal gets into an open wound, usually from a bite. It moves very slowly along nerves into your central nervous system, your brain and spinal cord. When it reaches your brain, the damage causes neurological symptoms. From there, rabies leads to coma and death. How common is rabies? About 59,000 people around the world die each year from rabies. In the US, human rabies cases are rare, fewer than 3 people get rabies each year. This is thanks to many people getting vaccinated soon after exposure. Who does rabies affect? Rabies is most common in rural parts of Asia and Africa, though it's found on all continents except Antarctica. In the US, rabies is commonly found in wild animals. But dogs carry rabies in many other countries. Children are more likely to get rabies than adults. How does rabies affect your body? Rabies moves from an infected wound to your brain over time. There are several phases that most people go through. Incubation, prodromal phase, acute neurologic phase and coma. Incubation phase. Rabies virus can spend days to weeks in your body before it gets into your nervous system, incubation. You don't have any symptoms during this time. If you receive treatment early in the incubation period, you won't get rabies. Prodromal phase. RAB travels through your nerve cells into your brain and spinal cord, causing nerve damage as it goes. The prodromal phase starts when the rabies virus has entered your nervous system. Your immune system tries to fight back, causing flu-like symptoms. Nerve damage might cause tingling, pain or numbness where you were bitten. This lasts 2 to 10 days. There aren't any effective treatments when rabies reaches this phase. Acute neurologic phase. In this phase, the rabies virus starts damaging your brain and spinal cord. About 2/3 of people have furious rabies, with symptoms like aggression, seizures and delirium. Others have paralytic rabies, with weakness and paralysis progressing from the bite wound to the rest of their body. Furious rabies can last a few days to a week. Paralytic rabies can last up to a month. Coma. Many people enter a coma in the final stages of a rabies infection. Rabies eventually leads to death. Causes of rabies. The rabies virus causes a rabies infection. The virus spreads through the saliva of infected animals. Infected animals can spread the virus by biting another animal or a person. Infected saliva. In rare cases, rabies can be spread when infected saliva gets into an open wound or the mucous membranes, such as the mouth or eyes. This could happen if an infected animal licked an open cut on your skin. Animals that can transmit the rabies virus. Any mammal, an animal that suckles its young, can spread the rabies virus. The animals most likely to spread the rabies virus to people include pets and farm animals, cats, cows, dogs, ferrets, goats. Horses, wild animals, bats, beavers, coyotes, foxes, monkeys. Raccoons, skunks, woodchucks. In very rare cases, the virus has been spread to tissue and organ transplant recipients from an infected organ. What animals get rabies? Rabies affects only mammals. Mammals are warm-blooded animals with fur. People are also mammals. Birds, snakes, and fish are not mammals, so they can't get rabies and they can't give it to you. But any mammal can get rabies, including people. While rabies is rare in people in the United States, with only 1 to 3 cases reported annually. About 60,000 Americans get post-exposure prophylaxis, PEP, each year to prevent rabies infection after being bitten or scratched by an infected or suspected infected animal. In the United States, more than 90% of reported cases of rabies in animals occur in wildlife. The wild animals that most commonly carry rabies in the United States are raccoons, skunks, bats, and foxes. Contact with infected bats is the leading cause of human rabies deaths in this country. At least 7 out of 10 Americans who die from rabies in the U.S. were infected by bats. People may not recognize a bat scratch or bite, which can be very small, but these types of contact can still spread rabies. Pets, like cats and dogs, and livestock, like cattle and horses, can also get rabies. Nearly all the pets and livestock that get rabies had not received vaccination or were not up to date on rabies vaccination. Most pets get rabies from having contact with wildlife. Because of laws requiring dogs to be vaccinated for rabies in the United States, dogs make up only about 1% of rabid animals reported each year in this country. However, dog rabies remains common in many countries. Exposure to rabid dogs is still the cause of nearly all human rabies deaths worldwide. Exposure to rabid dogs outside the U.S. is the second leading cause of rabies deaths in Americans. How can you tell if an animal has rabies? You can't tell if an animal has rabies by just looking at it. The only way to know for sure if an animal, or a person, has rabies is to perform laboratory testing. However, animals with rabies may act strangely. Some may be aggressive and try to bite you or other animals, or they may drool more than normal. Foaming. This is sometimes shown in movies as animals foaming at the mouth. But not all animals with rabies will be aggressive or drooling. Other animals may act timid or shy, move slowly or act tame, or let you get close to them. Because that's not the way wild animals usually act, you should remember that something could be wrong. Some animals may not appear ill. For the health and safety of wildlife, your pets, and yourself, leave wild animals alone, including baby animals. The best thing to do is to never feed or approach a wild animal. Be careful of pets that you do not know. If you see a stray dog or cat, don't pet it. This is especially important if you are traveling in a country where rabies in dogs is common. And if any animal is acting strangely, call your local animal control officer for help. Some things to look for are general sickness, problems swallowing, excessive drool or saliva, an animal that is overly aggressive, an animal that bites at imaginary objects, sometimes called fly biting, an animal that appears tamer than you would expect, an animal that's having trouble moving or may even be paralyzed, a bat that is on the ground. Risk factors for rabies. Factors that can increase your risk of rabies include traveling or living in developing countries where rabies is more common, activities that are likely to put you in contact with wild animals that may have rabies, such as exploring caves where bats live, or camping without taking precautions to keep wild animals away from your campsite. Working as a veterinarian. Working in a laboratory with the rabies virus. Wounds to the head or neck, which may help the rabies virus travel to your brain more quickly. How can you prevent rabies in animals? There are several things you can do to protect your pet from rabies. These include making sure your pets get regular rabies vaccines, keeping pets away from wild animals, spaying or neutering pets, and calling animal control to remove stray animals from your neighborhood. Many states also are vaccinating wild animals, mainly raccoons, to prevent the spread of rabies. Vaccine. Instead of trying to catch every animal and give it a shot, they use a vaccine in a special type of food that works when the animal eats it. The food is put out where animals are likely to find it. Sometimes airplanes and helicopters are used to get the food into places that are hard to reach on foot or with a truck. Prevention of rabies. To reduce your risk of coming in contact with rabid animals, vaccinate your pets. Cats, dogs and ferrets can be vaccinated against rabies. Ask your veterinarian how often your pets should be vaccinated. Keep your pets confined. Keep your pets inside and supervise them when outside. This will help keep your pets from coming in contact with wild animals. Protect small pets from predators. Keep rabbits and other small pets, such as guinea pigs, inside or in protected cages so that they are safe from wild animals. These small pets can't be vaccinated against rabies. Report stray animals to local authorities. Call your local animal control officials or other local law enforcement to report stray dogs and cats. Don't approach wild animals. Wild animals with rabies may seem unafraid of people. It's not normal for a wild animal to be friendly with people, so stay away from any animal that seems unafraid. Keep bats out of your home. Seal any cracks and gaps where bats can enter your home. If you know you have bats in your home, work with a local expert to find ways to keep bats out. Consider the rabies vaccine if you're traveling or often around animals that may have rabies. If you're traveling to a country where rabies is common and you'll be there for an extended period of time, ask your doctor whether you should receive the rabies vaccine. This includes traveling to remote areas where medical care is difficult to find. If you work as a veterinarian or work in a lab with the rabies virus, get the rabies vaccine. How is rabies diagnosed? Unlike most illnesses, you shouldn't wait for symptoms to diagnose rabies. If you've been bitten or scratched by a wild animal or a pet that might have rabies, talk to your healthcare provider right away. They'll examine your wound and ask questions to determine whether you need to be treated for rabies. You may also be tested for signs of rabies. Your provider may ask you, what kind of animal scratched or bit you? Whether they can test or observe the animal. If the animal could have rabies, it'll be watched for signs or tested, if possible. Animals have to be euthanized, humanely killed, to test them. Diagnostic tests. What tests will be done to diagnose this condition? Tests for rabies might include saliva test. You'll spit into a tube. It'll be sent to a lab to look for signs of rabies. Skin biopsy. Your provider will take a small sample of skin from the back of your neck. Your skin sample will be sent to a lab to look for signs of rabies. Cerebrospinal fluid test, lumbar puncture. Your provider will use a needle to take a cerebrospinal fluid, CSF, from your lower back. Your CSF sample will be sent to a lab to look for signs of rabies. Blood tests. Your provider will use a needle to take blood from your arm. Your blood will be sent to a lab to look for signs of rabies. MRI. You'll lie in a machine that takes pictures of your brain. Your provider will use the pictures to help determine what's causing your symptoms. How is rabies treated? There's no approved treatment for rabies once you have symptoms. If you've been exposed to rabies, were bitten by or been in contact with an infected animal, contact a healthcare provider as soon as possible. Clean the wound gently but thoroughly with soap and water. Ask your provider for additional instructions on cleaning the wound. Your provider will give you a series of shots, vaccinations, to prevent the virus from causing rabies. They'll also give you an antibody treatment directly to the wound if you've never been vaccinated before. What medications are used if one does come into contact with a suspected rabid animal? If you're bitten or scratched by a wild animal, there are steps you can take to prevent rabies. Medications prevent an infection from traveling to your brain if you've been exposed to rabies, post-exposure prophylaxis or PEP. These medications are often combined. Rabies vaccine. Your healthcare provider will give you 4 shots over 14 days. If you've already been vaccinated before exposure, you'll only need 2 shots. The vaccine teaches your body to destroy the rabies virus before it enters your brain. Human rabies immune globulin, HRIG. Your provider will give you shots around the wound. RIG gives you antibodies, molecules that fight infection, that will destroy the virus near the wound until your body takes over. You shouldn't get RIG if you've been vaccinated before your exposure. Side effects. Side effects of rabies treatment. You might have mild side effects of rabies vaccines, including pain, itching or swelling where you receive the shots, nausea, headache, muscle pain, dizziness. If you have severe side effects, contact your provider. What should I do if I've been bitten by an animal? If you've been bitten or scratched by an animal, wash the wound right away with soap and water. Use a 10% povidone iodine solution if available. Contact a healthcare provider or your Department of Public Health as soon as possible. Tell them what happened and give them as much information as you know about the animal. Was it a wild animal or a pet? What kind of animal was it? How was it acting? Ask your healthcare provider how best to clean the wound and whether you need a rabies vaccine. If you've been attacked by an aggressive wild animal, contact animal control. Can you survive rabies? You can survive rabies exposure if you're treated within a few days of exposure, before you have symptoms. Once you have rabies, that is, you're showing symptoms of the virus affecting your brain, there aren't any effective treatments available. Without early vaccination and antibody treatment, rabies is nearly always fatal. How long can you live with rabies? You can live several weeks or months after being exposed to rabies without symptoms. Once symptoms start, rabies causes death within a few days.